Wabarakatuh. Welcome. This is Stay Healthy and my name is Abdulrahman Gaddafi. Today our topic of discussion is spinal pain. With me in studio is Dr. Mahendra S. Chouhan. He's going to explain more about this. But before that, globally, 540 million people suffer from back pain at any given time. According to research done by National Library of Medicine, low back pain was ranked as the contributing factor of global disability out of 291 conditions investigated in 2010 and the third in Eastern Sub-Saharan Africa. In Kenya, it is estimated that 80% of people end up suffering from low back pain at some point in life. My dear viewer back at home, don't forget, this program is brought to you by Nairobi Neuro. Welcome. How are you, Dr.?
Hi,
good morning.
How are you?
Welcome.
Good morning.
Today our topic of discussion is spinal pain.
Yes.
And as we've seen from the research done by the National Library of Medicine, globally almost 540 million people. This means it's a common pain or common disease.
It's a very common, and these are the figures who reach the hospitals or the clinics.
Okay.
And then they are documented. But so many doctors who wouldn't even document. So it should be at least 3 times this figure that we are looking at. And there's so many women who are having the spinal pains on a daily basis, and it takes a lot of time for someone to reach a care center where they can show, So it's still we are just seeing the tip of the iceberg. Yeah, that's how that serious the spinal pain is.
Maybe let us speak about the pain generators of spine.
This is one of the most poorly understood thing even among many doctors, and it requires a very, very specialized research and understanding of the spine, because a lot of it was just focused at spinal surgeries, and that's how the spinal surgeries went into a disrepute, because if you don't understand from where the pain is coming, then the procedure which we are doing can go wrong, or it may be misplaced and patient may not feel good even after that. Sometimes it just requires a physiotherapy, sometimes it just requires an injection in the nerve. Sometimes it requires spinal injections, or sometimes a surgery is required, but all of it has to be understood. And now we are taking the science of the pain generation of the spine to the common people so that they can improve their daily lives by increasing the spinal health and prevention of the spinal conditions. So if we can switch to the presentation, where I would like to say that how important the disc is, and what's the importance of the spinal disc in the pain generation. So if we can shift to the presentation, where I want to show this video, that if you see that there is a flexible disc between 2 bones, and this is very critical. Inside there is a nucleus, outside there is an annulus. Both of these are flexible structures, and they are binding 2 inflexible structures, which are the bones, and then there are the joints, and then these joints are tied up by the ligaments. So this entire structure is the one which will be responsible for pain generation as degeneration happens, and everyone will go through the spinal degeneration in their due course of life. So that's why it's very important to understand for a common person who is entering from 20s to 30s to 40s as to how all these things interconnect with their daily lives, and how with certain exercises and with prevention of certain actions they can actually prevent the early degeneration of spine.
A lot of maybe young people, they claim that we're still young, no matter, we don't have to do exercise, because exercise is for those people or maybe elder people. Maybe what kind of advice can you tell them?
Even I'll take it further, like if you can see right now that there is the entire, if we continue to see on the video that I'm showing, that, please show the video. So yeah, so if you see this, I would like to replay it, that this is a disc, okay, and there is a flexibility of this disc, and sometimes it ruptures just like a tire can get punctured on the road. And then this nerve, which is, so this is the hallmark of one of the thing that we call a slip disc or disc herniation, that the entire disc can come out, and the nerve which is coming out through the holes in the spine, they get compressed. But this is what happens mostly in younger generation. But later on, if we see this, so we can see that there is a entire cycle of spinal degeneration. So you see this, there is a normal disc, and then gradually the bone starts degenerating and the disc height reduces, and then there is a increase in the surface area of the bone, or the joints degenerate. We call this facetal hypertrophy, that starts encroaching the nerve. Then disc leak happens, and gradually the disc goes even further, just becomes like a chip, and there is a further encroachment of the neural structures, and these nerve pains, then they cause the pain, and these nerves are going somewhere. Like from the neck they are going to the hands, from their low back they are going to the legs. So that's what happens. So many times pain is coming from the joint, many times they are coming just from the crack of the disc, or many times it is a total compression of the nerve, which will cause several symptoms.
Okay, let us speak about the prevention aspect on it, because whenever we have a problem, there must be a solution. Maybe what are some of the prevention aspects on this type of illness?
So coming back to your question, which you said that so many people think they are young.
Yes.
Yes, they are young. Like if we see a typical Somali lady who by the age of 30 must have had 5 kids. But each time when the pregnancy happens, the entire dynamics of the spine changes. And the hormones which are released during the pregnancy or the delivery, they tend to loosen the ligaments of the bone. The ligaments are something which ties up the bones together. So even the spine. So disc also degenerates at that time, and the joints also degenerate at pregnancy, particularly the last 3 months of pregnancy. So these women are always having nerve pains, or we call it sciatica, in the 3rd trimester of pregnancy and during the delivery. And even after delivery, they are also feeding the baby all of the time. So they are sitting in that position. Now no one is taking care of their spinal posture. No one is taking care of their rehabilitation of spine. So even females, if they are very aware of their health, they would like to reduce weight, but not more than that. So we need to be very spine specific if we are talking of the exercise. So many people say that since we are working whole day at home, we are exercising, all the body parts are moving, but that's not true, because spinal muscles have to be strong. If the spinal muscles are stronger, then there is a healthy distance between the two bones. That means the disc remains healthy. Plus we have to do a lot of flexibility exercises. So because this disc, it imbibes water and nutrition from surroundings. It does not have its own blood supply. So if you are moving in a certain way, like jumping, like skipping, if you do skipping every day, it keeps the hydration of the disc well. If there is well hydrated disc, it does not crack. If there is no crack, then there is no release of bad fluids from the disc. So there is no nerve irritation. So disc remains healthy for a longer time. So that's why we need to understand that there are certain exercises which everyone can do at home, and yet they can keep their spine healthy.
Maybe you can touch on some of those exercises, so that maybe those who are watching right now.
So one of the thing which is my favorite, which I'm going to speak soon about, is the some yoga exercises, which everyone can find on YouTube, and you will find thousands of videos, and the entire world is taking these exercises over, and like these are called sun salutation exercises. We call these as Surya Namaskar exercises. So it's a set of 9 exercises which is done. You can do a set of 5, you can do a set of 10. If you do 25, your spine is super healthy. And I'm trying to now connect science with this yoga postures, as how if you do it daily, even once after getting up, is going to keep the muscles of the spine very healthy. And if the muscles are healthy, then the bones are also healthy, and then the discs are moving in certain way that it draws the fluid and nutrition from surroundings. It remains hydrated, it doesn't crack, and so it restores the health. So once the disc is degenerated, we cannot regenerate it as of now. Although we do certain things like PRP injections, which can try to regenerate the disc, but regenerative science is still at its infancy. so far as disc is concerned. So best exercise would be two things. One is do skipping at home. Just say 100 skips in morning, 100 skips in the evening, which will keep the spring action of your spine, and it will cause the disc to imbibe fluids and nutrition from the surroundings, and that will remain flexible. The whole idea is to keep the spine flexible.
Okay.
Yeah, particularly in your late 30s and 40s, and particularly females. Yes. Even if someone is going in the gym, it doesn't make their spine healthy.
Okay.
Rather, if you go to a gym, sometimes it can accelerate your spinal degeneration, because there the weight training becomes the core of a gym, which is not good for spine.
Okay.
So unless you have a very strong and very flexible spine, all kinds of weight trainings, they can actually accelerate the degeneration of spine.
Because we are speaking about prevention aspects, and I think doing practices or doing exercise is one of them. Maybe is there any other way that someone can try so that at least
there are two. In my experience, I've realized if you have kept the mobility of your spine well, okay, then like the simple spinal rotations, spinal flexions, you can bend forward, you can bend backwards, you can rotate your spine. Those exercises done in the morning to just warm up. Then you do sun salutations, maybe just 5 sets. That's gonna keep your spine very healthy. And do the skipping things. Just 3 things if you do well. Drink a lot of water, okay. And another aspect is that, you know, the spinal pain is all about the spinal function. So what is the spinal function? It's the mobility of the trunk particularly, but it houses the nerves inside.
Okay.
So if the nerves are also having deficiencies like iron deficiency or like vitamin B12 deficiency, then the nerves will dysfunction. And if they dysfunction, sometimes it confuses or it compounds the spinal problems, that there is a mild compression, but because of the deficiency of vitamin B12, the nerve is aching more. So we have to correct those things as well. And again, my focus would be the women who have produced babies, because all their nutrition, whatever they're taking, is actually going primarily to the babies.
The baby,
yeah, even during the breastfeeding period. So they have to take their vitamin B12, vitamin D, and iron levels in check. They should check it every month.
That's a point to note down, especially for the women who are pregnant. And my dear viewer back at home, we're going to take a short break, but when we get right back, we're going to speak more about the pain that most women, they face in their pregnancy, and also our ladies, our mothers, our sisters, the pain that you face during your period times, and also intimacy. We're taking a short break. When we get right back here, we're going to tell you more about the spinal pain.
Horizon TV, the beacon for the nation. On the next episode,
mume wako amekushurutisha, amekulazimisha umnunulie pombe, umnunulie sigara, umnunulie mairungi, umnunulie bangi. Mwambie la, akitaka wacha kuachi. Amekuacha kwa sababu ya hilo. Wallahi Allah atakupatia lililo la kheri kuliko ili dude lilevi, dude ambalo kwamba na mairungi, dude ambalo kwamba ni lichafu.
what
What makes the exchange of goods and services interesting?
From the word Fayaz Bakers, anyone know what we are doing. So, but mostly we are known for our cookies and cakes.
What makes human beings seek for needs and wants?
When the customer takes the trip, we make sure that we call them and we say, how was the trip? And they'll come, oh, the trip was good, it was nice, okay, we've rewarded you with this.
What makes the young venture into business?
Alipenda kufanya sadaka and stuff. Alipataka kufanya vishete, so I told her, let me make vishete. So akanipatia kila kitu, I did it, and they turned out better than hers.
But what really motivates their actions?
I was telling brother, it's difficult. Usichoke, unaweza.
Join us on Show Me the Market as we seek to understand the market of different businesses for young entrepreneurs, only on Horizon TV.
Pearls of Wisdom.
Abu Huraira radiyallahu anhu narrated that the Prophet sallallahu alayhi wasallam said, "By him in whose hand my life is, it is better for any one of you to take a rope and cut the wood from the forest and carry it over his back and sell it as a means of earning his living, rather than to ask a person for something and that person may give him or not." Quote of the day. Imam Muhammad bin Idris al-Shafi'i said, "To admonish your brother in private is to advise him and improve him, but to admonish him publicly is to disgrace him and shame him."
Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Stay Healthy and my name is Abdulrahman Gaddafi Yasin. Our topic of discussion today is spinal pain, and earlier we have tackled a little bit and some questions that is commonly and most people maybe ask about the spinal pain. And before we took our short break, our discussion was around Daktari. Our discussion was around the women maybe who are pregnant and the type of pain,
prevention of pain.
Yes, and the prevention of pain. And now we've get back. Maybe I want us to tackle about our ladies, our sisters, our mothers. They get their periods each and every month, and some of them, they complain. They say, we receive this back pain. Even others, after intimacy, they are like, oh, my back, it's really paining. What can be the cause? Is it a normal thing?
So the pain of the periods is a little bit different. It comes from the uterus.
Yes.
Because it is located in front of the lower back or the lower spine, it feels like the pain is coming from the back, but that's what is called as a referred back, and because the uterus is engorged, and that's causing the pain.
Okay.
We call it as a dysmenorrhea. So that pain is a little bit different. Okay, in fact, there are certain pains which mix with each other, like if they have kidney stones, and the stone basically has to fall with the gravity, so it comes from the kidney, it goes into the ureter, finally comes to the bladder. But it can cause a pain as if it's going from the lower back and is going through your flank and going down. But exactly same pain can also be had if the disc is herniating in acute phases, although it happens more in young people, but it happens. If it is a periodic pain, then the physiology is entirely different. Sometimes if there is an infection in the pelvis, we call it pelvic inflammatory disease, that also will cause pain in the lower back. But then that's why MRI is very critical to any patient who comes to us. Most of the people, they come to us have got nerve pains, like they have got leg pains, which we call as sciatica. If that pain is coming and we know that there is a certain characteristic to spinal pain or the nerve pain, this comes from the lower back, it goes to the buttocks, then it can go to the thigh, either in the front or the side or the back, then it goes down the legs, and then it can also be associated with the tingling and numbness or pins and needles. In the legs, it can go all the way down to foot or the sole. So that's a very typical pain. It comes from one place, which is like low back, and goes to another place in a band-like fashion. That's so typical of spinal pain as well as the nerve pain. Spinal pain may be localized only in the low back. There can be arthritis of the joints. So mind you, spine has got 32 bones stacked one over other. Now anything which is stacked one over the other will have a stability issue over time, and that's why spine is one of the most common organs to get degenerated, because it is vertical. And as we have evolved from quadrupods like the tigers and the mammals, initially they were quadrupods and then gradually we became bipods. So the spine by nature was made to be in a horizontal position, and then we became erect. So that's why the joints, which are 64 joints in the spine, by the way, that means wherever there is joint, there can be arthritis. Arthritis just means inflammation of a joint. So these arthritis can play a role if you're not taking care of your spine in your 30s and 40s. Then definitely by 50s, anyways, 70% of people, if you do the MRI, will have a degeneration. So MRI is very critical to finding from where the pain is coming. It detects the uterine area, it detects the pelvic area for pelvic inflammatory disease, and it also detects the nerve compression or a disc herniation. So when people come to us, say we have got leg pain, I say we do the MRI of your spine. They say, but the pain is not coming from the spine. Yes, because the nerves are compressed, and nerves always give you pain, or you perceive pain in your brain depending upon from where the nerve has started. Okay. So even if you open a brain and if you touch the sensory area of the brain, a person will feel sensation or pain from where the sensory system is coming. Okay, so it's made that way. So it is also an awareness that most of the leg pains would have their origin in your spine.
And let us speak maybe about the surgery part. You find that most people, they fear spine surgery.
Yes,
maybe
they do.
how does it happen? And keeping in mind that there is technology nowadays, do you guys use technology maybe in terms of these surgeries?
Yeah, technology helps, but only it helps with when you're using it rightly. Okay. So like I would again like to do this presentation, if we can switch to
It is fine. Okay.
the PowerPoint. So something that is called as a disc tear, and I'll show you this one. So you're seeing there's just a small white dot, and this white dot we call as a annular tear, toxic annular tears. Now it's just a white dot, and many times so many people, particularly in the diagnosis making, including the radiologist, would not be looking at it as a very significant one. But these are the tears in the outer part of the disc, which is releasing the inner piled up chemicals which were toxic to the nerves. They irritate nerves, and the patient gets a out of proportion pain, which is a burning pain. So if we put a camera into the disc, you see like this. So now there is a very inflamed inside of the disc, and this is where the blood vessels are growing inside, new nerve tissues are growing inside. So the same tear which say happened last year will be less painful compared to now, not because the problem is increased, but because there is more and more nerve ingrowth in the torn disc, and more inflammation happens, and so more pain generation happens. Now this particular thing does not require a surgery, or it requires surgery in only chronic conditions. Mostly it requires a spinal injection. So if you do surgery in this case and you do an open surgery, then patient will not get the benefit. It will only give benefit if we have done an endoscopy in the disc. Okay, we have seen through the camera. Or if you know the knowledge well of this MRI finding, then you just give an injection. We may actually cause the healing of this tear, and that can be done as a day care.
Okay.
Yeah, patient can come, we do injections, after 1 hour they can go home. So unless we are very precise about what we are doing, the technology will fail. So now endoscopic spine surgeries are actually making so much of difference. Most of the surgeries that we are doing are daycare spine surgeries.
Okay.
Yeah, and so patient can come in the day. Even if we do a 2, 3 or even 4 hours of surgery, we're putting a very tiny 5 millimeter endoscope in the spine. We are seeing the actual pain generators, and we are just taking care of them. We don't need to cut open the muscles or the bones to expose the nerves. We can directly reach at the pain generator. We correct it and the patient is fine.
Okay, let us speak about the Nairobi Neuro Care. What are some of the maybe steps or new styles that you guys are using in when it comes to matters to deal with surgery?
Yeah, so the whole focus of Nairobi Neuro Care was to convert a spine surgery into a lifestyle surgery. Like few years back, knee replacement surgeries became lifestyle surgeries. They no more remained surgeries as such, because everyone has got knees, everyone will have degeneration of the knees, and so they are now changing their knees. Like in India, I was working in world's biggest center of knee replacement surgeries, and they do more than 10,000 surgeries a year. And I've seen so many people, they just come and say, and I know them, and I say, how come you're in hospital? They said, it's Friday, let's do the knee replacement, let me go back by Sunday or Monday at home. So we want to do the same thing with the spine. We are doing daycare spine surgeries and spinal pain management and nerve pain management. So you come there, you get yourself treated, and you can go home the same day. Sometimes we do some specific nerve injections far from the spine, and we can still get the pain relief in the spine. And we have several video testimonials, which right now I'm not showing, but we have them, and we have done almost 500 such procedures in last 4 or 5 years here. And now we get patients from surrounding 5-6 countries. In fact, very recently I'm receiving patients from as far as Eritrea and Spain. So these are all coming for spinal pain management and daycare spine surgeries. So that's where we are making a difference, that people are now less fearful of their spine surgeries. And we want the Kenya to become one of the health tourism hubs for spine.
For spine,
yes.
Okay, mashallah. And that's great. And maybe I want you to tackle about one thing that deals with the abdominal pain and this pain. What is the correlation between the two things?
Well, again, as I said, referred pain is to be understood. That pain always is felt from where it is coming. Now, a lot of the abdominal organs, they are going through the spinal nerves. You know, the nerve supplies through the spinal nerves, because what is spine? Spine is containing, it gives you a physical support for vertical structure, but it is also housing the peripheral neural system we call a spinal cord. And spinal cord basically is integrating the whole body with brain. So say the intestines, the liver, the gallbladder, all of these, the nerves are going back into the spine. From spine, the nerves are going back into your brain. So some of the, say there is a thoracic disc, disc slippage, or there is a bone tuberculosis, or there is a bone collapse. It will cause pressure on the nerves which are supplying over the abdominal wall. So now the pain will be referred to the abdominal wall, or we will say it's a stomach pain in a common terms. Of course, it can be some other reasons as well, but the spinal disc can also cause abdominal pains. Yes, it can.
Thank you so much, Dr. I'm being told that our time is up right now, but thank you so much for all the explanation that you've explained to us, and we have understood everything. And to you back from home, thank you so much for your company. My name is Abdulrahman Gaddafi, and don't forget, this program was brought to you by the Nairobi Neuro Care. And next week on Tuesday, when we meet at the same place, same spot, next week on Tuesday, we're going to discuss about headache. A lot of people, they complain about that, and you'll get the tips on how to manage and how to move forward with your life each and every day. This is Stay Healthy, and my name once again is Abdulrahman Gaddafi, and thanks to our Dr. Mahendra S. Chouhan. Assalamu alaikum wa rahmatullahi wa barakatuh.
HorizonTV, the beacon for the nation. On the next episode,
mume wako amekushurutisha, amekulazimisha umnunulie pombe, umnunulie sigara, umnunulie mairungi, umnunulie bangi. Mwambie la, akitaka wacha kuachi. Amekuacha kwa sababu ya hilo. Wallahi Allah atakupatia lililo la kheri kuliko hili dude lilevi, dude ambalo kwamba ni la mairungi, dude ambalo kwamba ni lichafu.
What makes the exchange of goods and services interesting?
From the word Fayaz Bakers, anyone can know what we are doing. So, but mostly we are known for our cookies and cakes.
What makes human beings seek for needs and wants?
When the customer takes the trip, we make sure that we call them and we say, how was the trip? And they'll come out, the trip was good, it was nice, okay, we've rewarded you with this.
What makes the young venture into
Mamangu
business?
alipenda kufanya sadaka and stuff. Alikuwa ataka kufanya vishete, so I told her, let me make vishete. So akanipatia kila kitu, I did it, and they turned out better than hers.
But what really motivates their actions?
I was telling brother, it's difficult.